Good afternoon, you with Newsfeed. I don't know if you've actually had COVID-19. So many of us have had. Some of us, like myself, have been very, very lucky. For other people, it's been very, very serious. But for some other people, they suffer from what is called long COVID. They suffer from the virus for a really, really long time. It has all sorts of impacts on them. It can make you tired for a long time, can give you headaches for a long time, difficult to think clearly for a long time. How do you manage this? Professor Renata Skuman is the head of the Healthcare Leadership MBA program at the University of Stellenbosch Business School. Professor, good afternoon to you. I mean, there are all sorts of discussions around COVID-19, around the impact of long COVID. You go online, you find so many people have really suffered from it, those headaches, that fatigue. It must have a big impact on people at work.
Absolutely. Stephen, the thing is that about 10 to 30% struggle with ongoing symptoms of COVID, even after the acute infection have resolved. And as you mentioned, fatigue, shortness of breath might be ongoing, but the big problem in a work or organizational environment is the impact it has on our cognition, the brain fog, the inability to concentrate, difficulties with memory, muddled thinking, inability to take decisions, and that obviously reduces people's productivity. One international study showed that after 90 days, 45% of people are not able to function fully at work, and 22% might still be absent from work. So the question then is, what should employers do in the workplace to assist employees?
One of the problems is to try and diagnose this. It's very easy if someone says, I've tested positive for COVID-19 and I'm still testing positive. It's much harder to try and manage a worker who's suffering from long COVID. They might test negative, but they still are suffering these effects.
Yes, it's an invisible disorder, and therefore there's also the stigma that we see in other mental health conditions associated with this, because some people might think people might be abusing the system. You know, I recovered, why are you struggling? And so forth. So it's important for employers to rethink their employee assistance programs and their wellness programs, and also to relook how they're going to look at sick leave. And then the important thing to know that according to law, you're not allowed to discriminate against someone with an invisible disease like mental health conditions or even then post-COVID. So it's important then that they look at reasonable accommodations. And what reasonable accommodation might entail is flexible work hours or a reduced workload. But we also know that it's very difficult at this stage where a lot of people were already retrenched, so your workforce might be smaller, and you don't also want to overburden your other employees. So it's very important for the employers also to collaborate with occupational therapists that can do assessments in terms of what is the person's functioning capacity and what is the reasonable accommodations we might be able to apply at work. The other very, very important thing is to also recognize that in the second month after COVID, so the first month recovering from the acute illness, but in the second month we might have reasonable accommodation. But by the third month, it's really important to have a multidisciplinary team approach and get psychiatrists on board and physicians and the occupational therapists to actively help the employee to recover from COVID, not just to book someone off for 3 months to rest. That's not going to resolve the issue and the cognitive difficulties that the person might be experiencing.
I mean, Professor, to work for a company that has all those resources would be wonderful, but I would say very few companies do. Companies that do employ people who can work in the psychological, psychiatric field, people with those skills are in hugely high demand right now.
Absolutely. Luckily, there are occupational therapists, companies as well, that specialize, that organizations can consult them. But the other thing is just what is the reasonable accommodations you can do, because it's not always possible. But the important thing is to have the conversation with the employee and to really have an individualized approach. And sometimes it's not huge adjustments that need to be made. With post-COVID, for example, people might find Zoom meetings even more tiresome than for the rest of us. And therefore, just changing that, or the load of Zoom meetings, the number of them, that might already give relief to the person. And then also, as I mentioned, flexi hours, where they might be more productive in the morning and they need to maybe rest a bit in the afternoon and rather utilize work again between 5 and 7, maybe in the evening after a short period of rest. But it's important that you need to take the person's individual aspects and needs into consideration without also doing something that's to the detriment of your other employees. So it is tricky. And therefore, we really have a call on organization, on healthcare funders, on the insurance industry, but also on my medical profession to collaborate so that we can have proper guidelines, proper diagnostic criteria about how we can diagnose long COVID, and also what should be the best evidence approach in terms of how organizations can support the workforce.
There's another problem here, and you mentioned Zoom calls, and this takes me exactly to the problem, which is, I mean, I've worked for a boss and come into the office, this is pre-COVID, and she would have taken one look at me and said, you really don't look right, I can see you're not right, you go home. And that's because that physical contact, you can see someone, I mean, we all have worked with someone and can see they're not feeling very well, they're not up to it, it's really much better for everyone to send them home. But on a Zoom call, you can't see that. You can't see that someone's eyes are red. You can't see that their voice is entirely croaky. You can't see that they're, you know, not quite with it. I mean, I find, I don't know about you, but I find it, there's a funny English word, I find it also discombobulating. When you're on a Zoom call, you really can't understand what's going on as well.
Yeah, there's interesting research about the impact of constant Zoom calls and Zoom conferences and what is the things that making us fatigue and what is the things that is so stressful about it. One of it is when we all stare in the camera the whole time. In normal conversation, you will be looking away from the camera, maybe at someone else. You know, to look at someone the whole time is quite intimidating as well. So that is a whole research topic on its own. But that's also why it's important. There's also onus on the employee. We are working in strange times. We are working from home, many of us. And as you said, we only have contact via Zoom. So there's also an onus on the employee to actually reach out and say and speak to the line manager or the leader and say, this is the difficulties that I'm struggling with. What can we do where I can still be my best for the organization, and how can you support me in this process? Things will go better again. And then also employees need to ensure that if they don't disclose the difficulties, they're not entitled to reasonable accommodation. And also part of reasonable accommodation is that you do get proper treatment. And also that you do proper self-care in terms of sleep, in terms of time away from digital devices, healthy eating, avoiding substances, all that good old things that we need to do, that we all know we should do.
Well, I mean, you know, saying goodbye to the digital device, it's usually too late by the time the worker has picked up their cell phone and thrown it through the window. And I hope I'm not the only person who's had that urge. I mean, we can't put the blasted things down, can we?
No, we can't. And I also sometimes wonder when people claim poor connectivity, you know, whether they're just not having I had enough of Zoom moments.
I wonder about productivity, and we see people suffering from real mental health issues. And let's be honest about this, it affects all of us. I find it, I mean, we've been talking about childhood hunger here on Newsfeed for the last half an hour. I find it quite difficult to sort of concentrate after a while because of how serious this is. And I'm someone who is as protected as one can be from the economic impact of all of this. What I'm talking about is that for all of us, there is a mental cost to what we're doing. People who are working are trying very hard to be almost more productive than we've ever been for a couple of reasons. One, we see so many other people who just can't be productive. Two, I think many people are worried about losing their jobs. Three, many people want to get as much money as they can now because everyone's worried about the future. All of this means that people who are working have more stress than they would ever have had or ever plan to have had.
We definitely all contribute, and some of the research just in general since lockdown started showed that mental health disorders, anxiety and depression, especially in the South African context, have almost doubled. Now that is a significant strain, and we can see it also in private practice and in the public sector, how we have waiting lists suddenly of months. And you feel guilty as a service provider as well that you're not able to accommodate everyone. If you accommodate everyone, your mental health will also struggle. But there's also amazing things that has been coming to the fore. You know, we have telemedicine now, so we are able to support people remotely, which usually wouldn't have had access to psychiatrists or psychologists. The other thing is just, as you mentioned, we are so scared of potentially not have the opportunity to work anymore. And what is interesting, there's also for a certain part of the population that say that their stress has decreased now with working from home. And that is specifically people that had long commutes that are now able to work from home and not having to commute. And the other are people that struggle with social anxiety, they actually find it less stressful to work and have a Zoom meeting than have in-person meetings. But in general, overall, I think we just see way more problems with anxiety, depression, sleep disorders, even substance abuse, and then also conversations that I know was previously held on the show in terms of domestic violence, for example, that has been on the rise. So there's a lot of difficulties. And I think the onus is on all of us to take care of ourselves. The onus is on us to take care of our family and our friends and our colleagues. And even if we do not have physical contact, pick up the phone and speak to your colleague. If you see someone maybe disengaging in a Zoom meeting, it might not be that it's only that the children are playing in the background and distracting them. They might be struggling. And we tend to forget that human touch of having a conversation with someone. And that's all of our responsibility, not only employers, but all of us should look after the people around us as well, keeping that social connectedness.
Call me old-fashioned, but I find a good old-fashioned phone call where you don't have any lag is so much more effective than a Zoom call. Professor Anita Skuman, Head of Healthcare Leadership at the MBA program at the University of Stellenbosch Business School. I do appreciate the time. Thank you very much indeed. Well, coming up for you, don't forget the replay of that really important interview with Ace Makushile, my colleague Tami Ngubani. You do want to watch it again at 10 o'clock tonight. Also, in a moment, Mbali Tatani, our reporter live at the home of the Joburg Mayor General.